I am Mariam Asise, and I am a second-year medical student at OSU. Today I will be discussing research findings collected by me and my colleagues Hannah Vaughn and Vanessa Donaldson. Over 1 month in the summer of 2023, Oklahoma State University's Center for Health Systems Innovations granted 8 incoming second-year medical students the opportunity to evaluate the inpatient discharge process at OSU Medical Center, specifically within the medical surgical units using lean healthcare training. We were educated on the lean management philosophy through 2 lean trainers in order to observe and evaluate the current state of the inpatient discharge process at OSU Medical Center. Our goals were to understand the current discharge process at OSU, identify the key players from patient admission to discharge, identify obstacles that disrupted or complicated the flow and created waste, and minimize the potential waste within the current state of the discharge process. We spent our first few days of our internship understanding the lean theory in management and principles within lecture and simulation settings. We were then able to visit OSU Medical Center, understand our landscape, and begin our Gemba walk, which is a method to observe employees in their workplace, ask them about their tasks, and identify productivity gains. We spent a couple weeks solely observing the ins and outs of patient discharge, and information was collected for over 40 patients and talking to staff among different shifts and units involved. We then developed a flowchart portraying the current state. Next, after we developed an in-depth understanding of the discharge process, we identified inefficiencies. Our results are demonstrated in the chart. We divided up the entire discharge process in 3 stages. Stage 1 began with patient admission and ended on the morning of the patient's discharge. Stage 2 began with the resident and med student pre-rounds to when the discharge order was placed on Epic, noted by a green car. Stage 3, our final stage, begins after discharge order is placed to when the environmental services are contacted. We noted inefficiencies being within 3 main categories: communication, lack of standardization, and a lack of clearly set defined roles amongst employees. We then provided an in-depth recommendation for each department. We endorsed increasing communication between nursing staff, physicians, ancillary services, and case management. We also encouraged order sets and checklists to increase standardization of the discharge process because during our observation, we found that every floor and every shift had a skewed way of discharging a patient that differed from others. Lastly, in order to set more clearly defined roles, we recommended identifying the responsible party for obtaining the discharge pharmacy and transportation of the patient out of the hospital. This is because while obtaining our data, we found that the responsibility fell onto the nurse completing the discharge after the physician order had been placed, often delaying transport and eventual discharge. Overall, these 3 subject matters of inefficiencies are what led our analysis of the discharge process at OSU Medical Center. We presented our findings to the medical center's C-suite, and since then we have been notified of continuous improvement to implement a more efficacious quality of patient care at OSU Medical Center.